Well, thank you for joining us this morning, Elizabeth. Just a few questions. We're wondering what your most memorable experience was while you were serving as president.
When I had the pleasure and privilege of being president of the ASDS in 1996, at that time we had just blossomed into a real organization, and now we had spent a lot of energy on that, and it was time to move out and give back to our community and to our patients. And so for me, the most important part of my presidency was the establishment of what was called the SCORES program, skin care outreach to empower survivors. And we set up the first program under Dr. Chris Harmon and Dr. John Yarborough to do that work with our patients and our community. And that was the first outreach program that the ASDS did.
It was a tremendous program.
Mm-hmm.
Thank you.
Thank
What were
you.
the issues that were going on at the time?
Well, probably the issues that were going on at the time that were most important, they were twofold. First of all, there was unfortunately a very acrimonious turf battle going on with the plastic surgeons, and they felt like dermatologists should treat the skin, and anything below the top layer of the epidermis belonged to them. And so we had to do some holding out of our hands and standing our ground and pointing out of all the many advances that derm surgeons had done, beginning with even dermabrasion and hair transplants. And so that was very difficult. The other thing that happened was that was in 1996 when lasers were becoming really, that they were the instrument, the surgical tool that everyone wanted to learn about and use. And we were first at our executive committee had to discuss, should physicians be using it, should non-physicians, and we passed the first guideline on that we felt that it should be a physician oversight on the use of lasers.
Well, 20 years later, those discussions are still happening in both of those issues, with plastic surgery and sort of defining territories and showing how we have made so many developments in those areas, and in terms of who should be using lasers and light sources and injectables. So
absolutely,
the battle continues.
And I think the ASDS needs to continue to stay at the forefront there and set the standards.
Mm-hmm. Well, in addition to lasers, because that was coming out there, what other innovations were happening at that time?
Well, the liposuction was really taking off then under the guidance of Patrick Lillis, Bill Coleman, and Rhoda Narens. And that is, I think, where we really kind of met a wall with our other colleagues in that regard, was because of the liposuction.
Right. Again, turf battles.
And the other thing was accreditation of our ambulatory surgery centers in our offices. And we, during my term, we joined the AAAHC, the ASDS sat on their board. And the other thing we did, and I was very proud of this, is that we made application to the AMA to become a surgical specialty. And they recognized that, and so we became part of the surgical forum or caucus at the AMA, which I think was a big step for our specialty.
Very big step, thank you. Now, in terms of your practice, sort of looking back, do you have any patient that in particular stuck out to you as being most memorable or impactful?
As most people, we have many that really have touched our hearts and souls and our minds. Probably the one, because I was doing a lot of work with lasers, and the one that really was most prominent in my mind was a lady who came in that was all blue. And she had bought some silver-containing health tablets over the internet. She had Argyria, and we were able, the lady no longer went outside, she was inside all the time, and because she was so embarrassed for her condition. And what we were able to do with one of our lasers, the 532 Q-switch neodymium YAG, was treat her face and make it normal again. And she was incredibly grateful for that, and I think that was one of my highlights.
It's amazing. We're so fortunate to be able to change people's lives and affect it in such a positive way.
Absolutely.
If you look back over your career, is there anything you would change or do differently?
I've really had a good career, and I'm very grateful. I probably would have done more surgical training than I was given in my residency, and I wish I had done more of that, and if I had to go back and change or add to it, but I would still be a dermatologic surgeon.
Yeah, there wasn't much training available at that time. You were a pioneer.
Well, we spent a lot of time in other people's offices is how we learned. Actually, we'd go and observe people who were doing a procedure, and we'd go visit with them. There really weren't courses to attend at that time.
Yeah. What advice would you give to today's young dermatologic surgeons?
Well, I would tell them first to always put their patients first. And I think as a professional, that will serve them best in their career. And to remember that and to continue to read the literature, stay up to date, and offer the very best medicine for their patients. And I think they will do well.
That's great advice. What about advice for the ASDS leadership today?
We need to engage our young people, which they're doing with the Future Leaders Network, and I think that's the most important thing, is to keep our young members engaged and to reach out to them not only through the Future Leaders Network, but also digitally, which Quest has certainly been doing that.
That's great. Well, thank you so much.
Thank you.